Welcome, everybody. Hi, my name is Tiffany Porter. I'm the nurse practitioner at Peak Health Institute. Thank you so very much for joining me today. During the next 30 to 45 minutes, I will be discussing regenerative medicine and biologics. I will be explaining different types of biologics, including stem cells, exosomes, and Wharton's jelly, and how they can be used for various health concerns. I will also be covering PRP, or platelet-rich plasma, and then finally, I will be discussing some complementary therapies we offer here at Peak Health with a focus on peptides. These complementary therapies are great to pair with and accelerate the biologics I will be discussing. They can also be great tools for health optimization, cosmetics, and weight loss. So we will touch on those areas as well. I know you all had the opportunity to submit questions upon signing up for the webinar. I did look at all of them in advance. So at the very end of this, I will address those questions for you. A lot of them will be answered during the presentation as well. There were a few great questions, but unrelated to today's topic of discussion. So I will not address those directly during this presentation today, but I do really appreciate those questions and I would be happy to address them individually or via portal message later in time. Okay. So what is regenerative medicine? So regenerative medicine involves the application of new and exciting treatments to heal tissues and organs and restore function loss due to damage, disease, and aging. Our bodies have this natural ability to heal themselves in so many ways. So think about when you cut yourself, your skin repairs itself, you break your bone, and the bone heals itself over time. Through the use of regenerative medicine, we can actually capture that naturally occurring ability to heal and apply it to a wide range of health conditions. So I'd like to discuss this further. So biologic therapy and regenerative medicine go hand in hand. Biologics are regenerative substances present in various tissues. These products are isolated from natural sources and they contain substances that have been created using living cells or organisms. Biologic therapy involves innovative treatments utilizing these regenerative substances that enhance the body's natural capacity to heal. So let's talk for a second about how these biologic products differ in a way from conventional drugs. So in contrast to most drugs that are chemically synthesized and their structure is unknown, most biologics are complex mixtures that are not easily identified or characterized. So biologic products often represent the new cutting edge of biomedical research. And in time, I predict that they may in fact offer the most effective means to treat a variety of medical illnesses and conditions that presently have no other treatments available. So now I'd like to dive into some different types of biologics and how these can be used. First on my list are stem cells. So part of what makes stem cell therapy so great is that these cells have the ability to self-renew and differentiate into various types of cells in the body. Stem cells contribute to multiple tissues, including bone, cartilage, skeletal muscle, your meniscus, your tendons, your ligaments, the labrum, even the neural system and the heart. Delivery of stem cells or combining delivery of stem cells with various therapeutic agents like PRP and peptides, which we will discuss later, to target specific tissues or organs has the potential to enhance, modulate, and even initiate repair processes, both locally and systemically in the body. Another important application for stem cells that I love to point out is its impact on the immune system. Stem cell therapy can help the immune system to rebuild itself, which leaves the body more prepared for illness it may face in the future. This therapy is also capable of helping the body to defend itself against illness it is currently fighting. So when we talk about stem cell therapy, we commonly hear this term mesenchymal stem cells, or you'll see the abbreviation MSCs. This is because the mesenchymal stem cell is an ideal vehicle for cell-based therapies by introducing beneficial genes. Mesenchymal stem cells are multipotent stem cells found in bone marrow, adipose tissue, and the umbilical cord. They have the ability to differentiate into a variety of different cell types, including bone, cartilage, adipose tissue, which is our fats, and muscle. When receiving a stem cell therapy here at Peak Health, the stem cells are umbilical cord derived stem cells. Now, the reason we do not obtain and use stem cells from the patient or from our own bodies is because of factors such as aging, inflammation, and disease. These factors deplete our stem cells and cause them to be much less robust. A pivotal source of mesenchymal stem cells is the umbilical cord's Wharton's jelly. Wharton's jelly is the main connective tissue found in the umbilical cord. It is a thick gelatinous substance. It's made up primarily of collagen, and its main purpose is to provide cushion and protection for the blood vessels in the umbilical cord and aids in helping the umbilical cord to function effectively. Many people associate this with pregnancy because the substance does play a critical role in supporting healthy pregnancy. And then mounting evidence does suggest that the substance yields health benefits long after birth. This is because Wharton's jelly is so rich in mesenchymal stem cells. In fact, this particular biologic has the highest concentration of stem cells, which are crucial for the regenerative process. As already mentioned, one great feature of Wharton's jelly is that it provides cushion, protection, and structural support. This makes Wharton's jelly a great substance and treatment choice for joint injections. A little bit on how Wharton's jelly works. So Wharton's jelly injections do have the ability to develop, as previously mentioned, into many different types of cells through a process called differentiation. Wharton's jelly treatment takes advantage of the body's total ability to repair itself. And by utilizing this type of injection, we provide anti-inflammatory properties. These properties are similar to that of a cortisone or steroid injection. However, this particular type of joint injection goes far beyond the benefits of standard injection therapy while eliminating those unwanted side effects that we get with steroid injections. And a recap of Wharton's jelly benefits. So Wharton's jelly injections contain absolutely no steroid, while the results can be comparable. Instead, the injections rely on naturally occurring anti-inflammatory agents in the body, such as cytokines. Wharton's jelly injections do contain hyaluronic acid, which is what makes it really great for lubricating cartilage and promoting new cartilage growth. The injections also contain growth factors, which stimulate tissue growth. And then another perk to utilizing Wharton's jelly is that there is absolutely no threat of patient rejection with this product. Next, I would like to discuss exosomes. So exosomes are small intracellular vesicles of information. They contain proteins, growth factor, genetic material, and other biologically active molecules. Exosomes can program your stem cells to do certain things. They are very, very powerful mediators. They carry all the signaling and machinery necessary to alter the behavior of a neighboring cell in the body. When released under normal circumstances, exosomes are involved in cell differentiation, maintenance of cellular homeostasis, regeneration of tissues, and proper functioning of our immune system. So, as we age, our stem cells become fewer and fewer and less active, and we heal slower than we did when we were children. By providing or receiving exosome therapy, we can wake up our own stem cells that are not functioning in the ways that they did when we were younger. Since exosomes are the messengers that stem cells send out, they carry the message from the stem cells to your cells, telling your cells to act the way they did when they were young. So both stem cell and exosome therapies get a great deal of attention for both general wellness and condition-specific treatments. But you may be wondering if there's a difference between the two therapies, and do they have the same benefits? So stem cells, you'll find they're on the left hand of the slide. Stem cells are the body's master cells. They are very highly beneficial to help increase cell signaling in the body. They generate all other cells in the body, and they have the ability to self-replicate. That is key with the stem cells. They can be administered via injection form to a specific area of the body or via IV infusion for systemic therapy. And then another thing to point out with stem cells is that they do not break the blood-brain barrier when introduced in the body. So let's move to exosomes, because exosomes, on the other hand, are responsible for carrying genetic information and proteins to different areas of the body. Unlike the stem cell, exosomes are not full cells, so they do not have that ability to self-replicate. This eliminates any concern for replication of harmful cells in the body. Also, unlike stem cells, exosomes can break the blood-brain barrier, making them a more ideal choice for neurodegenerative disease or conditions. Depending on the patient, exosomes may be considered a safer option if creation of those or replication of those harmful cells is a concern. And then exosomes, like stem cells, these can be administered via injection to target a specific area of the body, or they can be administered via IV infusion. PRP. So platelets are small non-nucleated bodies in the blood, primarily known for clotting. They also contain proteins, cytokines, and bioactive markers that aid in wound and tissue healing. What makes PRP unique is that platelet-rich plasma therapy utilizes concentration of the patient's own platelets. So we do utilize your blood for this therapy in order to accelerate healing of injured tendons, ligaments, muscles, and joints. Activated platelets release growth factors that stimulate and increase the number of reparative cells in your body produces. So on this next slide here, I have an example of the PRP process. So you'll see here, we do collect the blood directly from the patient's body, and then that blood is spun down in order to retrieve that concentrated platelet-rich plasma. When we obtain the platelet-rich plasma, that is reintroduced into the body or into the affected area directly via injection. Now, indications for PRP. So these listed on the slide are just some of the most common issues I treat with PRP: tendinitis, muscle tears, injury, osteoarthritis, and even bursitis. At the bottom there, you can see I do mention exosomes are a great booster, or PRP, I'm sorry, is a great booster to exosome treatment. Adding PRP to exosome therapy just enhances the regenerative properties even more by adding additional growth factors and cytokines. So thus making that treatment much, much more effective. So now I'd like to take it a bit further and talk about how these individual biologics can be applied. So every patient is different. Maybe you have a sports injury. Maybe you have bad knees and doc recommended knee replacement surgery and you're wanting to avoid that surgery. Maybe you have a chronic condition, heart disease, stroke, diabetes, osteoarthritis. These are all examples of conditions that are long lasting and typically do not resolve on their own, unfortunately. In many cases, these symptoms and conditions are being managed with prescription medications, medical devices, and even surgery. Maybe you're the opposite kind of patient. Maybe you are already pretty darn healthy and you're looking to maintain optimal health. Maybe anti-aging and health optimization are your goals. Regenerative medicine and biologics go way, way beyond disease management, and they actually work to support the body in repairing, regenerating, and restoring itself to a state of well-being. So let's look at the joint injection patient first. All of the above mentioned products that I have discussed are capable of being used as a joint injection. For a patient that needs treatment that provides cushion, support, and lubrication to a joint space, Wharton's jelly is the only biologic that has the proper structure to do that. So PRP is also a nice option for injection. I have had lots of success using PRP for things like arthritis or pain management in major joints due to its ability to improve function, reduce pain, and reduce inflammation. With stem cell therapy, we can actually regrow or regenerate healthy tissue and bone to allow your joints to heal. And when we inject exosomes into a joint, the exosomes work to signal cells to return to healthy function. So again, which of these products is right for you will be thoroughly assessed during an office visit, and we will choose the appropriate product depending on your situation and specific needs. On this next slide here, I'd just like to point out what a healthy knee looks like compared to an osteoarthritic knee. So this would be a patient that would benefit greatly from a Wharton's jelly injection, something that provides that cushion and support. So you can see on the left side there, That is a normal knee. Normal cartilage, meniscus is healthy, and it has a nice even joint space. On the right-hand side, this patient has bone spurs, loss of cartilage, and joint space narrowing. So when we have that joint space narrowing, that bone on bone, that's where we get that rubbing and that severe pain. If we can inject a substance like Wharton's jelly that has cushion and support, that can eliminate that pain and actually help to repair the disease in that joint. So I like to add this in, and this is essentially aftercare instructions when using regenerative medicine and biologics. Everybody likes to know ahead of time if there are any restrictions after, or if they need to do anything special after receiving one of these treatments. So some of the big things here, I always tell patients to rest for 24 to 48 hours. After that, I do not like patients to be sedentary. Moving is wonderful. We just want to restrict our exercises. So no high impact for the first 2 weeks post-treatment. Typically at week 3 to 4, you can resume walking, cardio, light weightlifting. Absolutely no NSAIDs. So those are your non-steroidal anti-inflammatory drugs, your ibuprofen, Motrin, Advil, naproxen, at least 2 weeks. I like to tell patients ideally 4 to 6, and that is simply because these biologics, these regenerative substances, they work off of your inflammation. So if we are taking over-the-counter drugs that are minimizing our inflammation, these products will be less effective. A few extra things I put at the bottom here. Ice sparingly. Again, we want that inflammation to be there, so we like to encourage patients to use that only as needed. Dry heat can be alternated with that as well. And then I love turmeric. Turmeric is a great natural anti-inflammatory option that will actually not disrupt or impede the effectiveness of your therapy. IV therapy with biologics, including stem cells and exosomes, has a multitude of benefits, regenerating damaged tissues and organs, relieving your chronic pain, and enhancing overall quality of life. So again, during your visit, we would determine based on history and presentation, which product of the two would be best suited to your needs. And there is an important distinction to be made between injections and infusions with biologics. So regenerative medicine injections are when the product of choice is injected directly into a specific part of the body. So for instance, if a patient was strictly suffering from knee pain, as shown in the previous slide, they may choose injection therapy with biologics. For that patient, the product would be injected directly into the knee of the patient in need. While this direct method can be very effective toward acute needs, if the patient needed treatment on a much larger scale or had multiple areas of concern, the biologic infusion may be the preferred option. Infusions are ideal in cases where a wider area of the body requires treatment, or in cases where the product cannot be effectively injected into the area where the patient needs it most. Before moving on to peptides, I would like to touch a bit on applying regenerative medicine to aesthetics. So PRP, stem cells, and exosomes, all three have become increasingly popular for their cosmetic uses. This is all due again to the regenerative properties of biologics that can improve the aesthetic aspects of our body, such as the skin and the hair. So not only can biologics help to make these areas look good as ever, but they can do so in a minimally invasive manner that will leave any prospective patient very satisfied with the results. So when applying biologics aesthetically, we have a goal of minimizing fine lines and wrinkles, increasing collagen and elastin in the skin, evening skin tone, minimizing scarring, and even improving hair quality and hair growth. I do like to point out that when using biologics for cosmetic purposes, this does not work the same way as injecting something like Botox. So PRP, for example, when used for skincare or hair growth, this product continues to work in the body over a period of at least 6 to 8 weeks. So whereas something like Botox, you see a result immediately, PRP, for one, is a natural substance compared to the former option, and it continues to work in your body. So while the results are obtained slower, they are longer lasting, and the product does continue to work over time. Okay, so peptides. a great biologic add-on for everything discussed previously, so our joint injections, our IV therapies, and our aesthetic treatments as well. Also great for things I will talk about a little bit later, health optimization, weight loss, and so much more. And I say so much more because there is a peptide for just about everything. Today, I'm going to single out the peptides that work great for pain and cellular repair. And then I'm also going to put focus on the peptides that work great for weight loss. This is because at the end of the day, maintaining a healthy weight helps us to relieve chronic pain and joint issues. It reduces inflammation, it can help prevent chronic disease, and it helps us to improve overall quality of life. Now, what are peptides? Peptides are compounds of amino acids. The amino acid chains typically comprise of 20 to 50 amino acids. Amino acids are also the building blocks of proteins, but proteins contain more. Peptides are easier for the body to absorb than proteins because they are much smaller and more broken down than proteins are. They can also be more easily penetrated into the skin and the intestines, and this allows them to enter the bloodstream more quickly. Different bioactive peptides have different properties, so the effects on the body depend on the sequence of amino acids the peptide contains. Peptides are also frequently used to achieve the following effects: cellular repair, wound healing, decreasing pain and inflammation, weight loss, building strength and muscle mass, and the list goes on, but we will focus on all of the above mentioned today. So these are 3 peptides I am going to focus on for pain and cellular repair. These include BPC 157, TB 500, and AOD 9604. Okay, so my first one here is BPC 157. BPC, also known as the healing peptide, when taken orally or injected into the body, has the potential to speed up healing, reduce pain and inflammation, improve your muscle strength and your endurance, improve joint and tendon health. It reduces risk of injury, it speeds out workout recovery time, and enhances immune system function and brain function. BPC also reduces the risk of oxidative stress, which is the imbalance of free radicals and antioxidants in the body. High levels of oxidative stress result in chronic inflammation. So this may affect our vital organs, including the heart and the blood vessels. High oxidative stress levels can also increase our risk of developing conditions such as high blood pressure and heart disorders. I like to point out that BPC can also modulate nitric oxide, which works as a vasodilator. So in doing so, this particular peptide can regulate low and high blood pressures. When compared to other medications or supplements, BPC is incredibly safe and does not come with a long list of negative side effects. This is simply because BPC is in fact a naturally occurring peptide produced in our bodies. TB500 is a peptide derived from the naturally occurring peptide thymosin beta 4. TB500 is great for enhancing healing, tissue repair, and also regeneration. It helps to stimulate our muscle growth. It improves strength and endurance. It reduces inflammation, decreases acute and chronic pain. And then as a side perk, it helps to increase hair growth. So I like to point out the hair growth because that also makes TB500 a great add-on therapy for biologic hair growth treatment with PRP stem cells or exosomes. Its anti-inflammatory properties also make it appealing for patients with inflammatory issues, including but not limited to rheumatoid arthritis, lupus, Crohn's disease, and even Alzheimer's. AOD 9604 is my final peptide in this category. And while AOD is better known as a weight loss peptide, research has discovered this particular peptide has other beneficial regenerative properties. AOD is capable of increasing muscle recovery. It has great anti-aging benefits. It helps with boosting energy levels, and it has reparative and regenerative properties as well. The reparative and regenerative properties of this particular peptide, I like to point out as well, are accelerated very nicely when used together with BPC 157. Some diagnoses that may benefit from AOD osteoarthritis and osteoporosis, patients with worn cartilage or bone damage, patients with high cholesterol, and those with diabetes. So aside from the properties listed on this slide, AOD is a very well-known peptide for weight loss, which brings me to our next section of peptides, our weight loss peptides. And we are going to talk about 4 of them today. As previously mentioned, maintaining a healthy weight helps to relieve chronic pain and joint issues, reduces inflammation in the body, can help prevent chronic disease, and improve overall quality of life. So the more weight and inflammation we hold on to, the more likely we are to experience pain and chronic disease. The weight loss peptides I'm going to discuss today include AOD 9604, so we'll elaborate a little bit more on that one. And then we will talk about MOTS-c, CJC 1295 with ipamorelin, and then we will end today with semaglutide. First, I'm going to continue on with that AOD to build upon its benefits, as this is a beneficial peptide for all of the topics that we have discussed today. While AOD 9604 has other great benefits mentioned on the previous slide, the peptide, as I mentioned, is most commonly known as the fat-burning peptide and is FDA approved for weight loss. AOD is an analog of human growth hormone developed to combat obesity and aid in weight loss. So this peptide works by stimulating something called lipolysis, which is the breakdown of fats and lipids, while inhibiting something called lipogenesis, which is the metabolic process of fat formation and helps to regulate how the body burns fat. This particular weight loss peptide is great for burning fat in the abdominal region. So great addition for those trying to lose that stubborn belly fat. Upon injecting this particular peptide, you are actually mimicking the way natural growth hormone regulates your body's fat metabolism without imposing any negative side effects on your blood sugar. This mitochondrial-derived peptide promotes metabolic homeostasis. So MOTS-c, in doing this, helps with weight loss. It improves glucose regulation. It regulates your mitochondria, improves physical performance, promotes resistance to metabolic stress, and does protect against insulin resistance as well. This peptide primarily targets fat and skeletal muscle, making it a perfect addition to any weight loss plan. And because MOTS-c regulates metabolic functions throughout the body, including turning glucose into usable energy, this peptide is great for improving blood sugar levels, especially those with obesity or a diagnosis of type 2 diabetes. I love using CJC 1295 with ipamorelin due to its long list of sought-after benefits. CJC and ipamorelin are paired together to maximize the amount of growth hormone being released into the body. This creates a safe and therapeutic anti-aging benefit and is one of my favorite peptides for those seeking tools for anti-aging. For weight loss, CJC with ipamorelin is good for improving insulin sensitivity, thereby reducing the body's triglycerides and blood sugar. This aids in burning of more fat. You'll see CJC with ipamorelin also strengthens the cardiovascular system and increases muscle mass. So more muscle equals higher metabolism, which equals less body fat. So with an increase in muscle mass, the body's resting metabolic rate is increased, leading to more calories burned throughout the day. While I typically do not use CJC with ipamorelin alone as a treatment for weight loss, it pairs very well with other weight loss peptides and also pairs great with our peptides for pain and cellular repair, as CJC is helpful for recovery and repair from injuries. It increases bone density, and it does help strengthen the immune system as well. This particular peptide is recommended to be taken at night in order to maximize that body's natural cycle of growth hormone. As a result, it stimulates the pituitary gland during REM sleep. And finally, we are going to end today's peptide discussion with semaglutide. So while not our first line of action for weight loss, semaglutide is an effective tool that is available if needed, and I do use it on a good handful of patients. Semaglutide is a derivative of the naturally occurring GLP-1 or glucagon-like peptide receptor agonist, a peptide known to lower blood sugar and enhance insulin secretion. Semaglutide mimics the GLP-1 hormone released in the gut in response to eating. This peptide was originally used in type 2 diabetes to help improve glycemic control. It has been shown to significantly decrease appetite by delaying gastric emptying and reducing intestinal mobility. Thereby, it helps to reduce caloric intake. When utilizing this particular peptide, I do like to point out some of the potential side effects that we don't see with some of the other peptides discussed. So with this particular one, I will sometimes see some nausea, a little bit of dizziness, maybe headache or GI issues, including diarrhea, constipation, gas, and bloating. And then this particular peptide is recommended for those who meet one or more of the following criteria. So we either want that BMI or body mass index to be above 30, or it can be above 27 and have other weight-related conditions, such as high cholesterol, hypertension, or diabetes. And so to sum things up, regenerative medicine is a game-changing area of medicine with the potential to fully heal damaged tissue, offering solutions and hope for people who have conditions that were once thought to be completely beyond repair. As you can see, between regenerative medicine, biologics, and peptides, there are various treatment options available that can be utilized and customized to your specific needs. We look forward to seeing you here in our office and having the opportunity to work with you on achieving your health optimization goals. So now I would like to transition into answering some of those questions that were submitted when you signed up for the webinar. So I'm going to pull those up. Okay. So again, a couple of these were unrelated. I would be more than happy to address them. They're great questions, but for time purposes, I'm going to focus on the ones related to today's discussion, okay? So my first one, we're wondering about use of cannabis products in diets to help curb autoimmune disease. We're already eating pretty good diet of anti-inflammatory foods and also have a Hashimoto's diagnosis. So eating a good diet is great. I do like to point out for that particular diagnosis or autoimmune issues, gluten-free is great for Hashimoto's patients since that does reduce inflammation and thereby reduces antibody levels for Hashimoto's. As far as the cannabis products go, so I know we didn't discuss that today, but cannabidiol has been known to slow down T cell production and suppress immune system memory. So that's something that I think can be very useful. Something like CBD could cut down on autoimmune attacks, also beneficial for management of oxidative stress. And by reducing oxidative stress, you can in fact reduce oxidative damage from autoimmune disease. So that could be helpful in repair. Weight loss options and anti-aging tips, I do believe I covered that. So all of the biologics and the peptides in various different combinations could be used for weight loss and anti-aging, depending on your specific needs or concerns. Diet or supplement recommendations for hair, skin, and nails. So I didn't really specify any supplements for hair, skin, and nails, but we do have a various amount of supplements we can use for that. And specifically, zinc, selenium, biotin, those are all really great. Biotin specifically in higher doses. And then PRP has been really successful in hair growth. So I don't know if the question's more directed towards growing longer hair or for thinning hair, but PRP can be useful in either or. And then a few of these I will answer a little bit later. Does losing fat help more with pain? What is the best weight loss peptide with inflammation benefits? So you probably know already, we answered this one as well, but I will readdress it. So the answer is yes and yes. Losing fat does help with pain, and certainly it's to varying degrees. Everybody is different, but all of the peptides mentioned could be useful for this. Depending on your current condition, we would decide which ones would be best suited for you and your specific needs. And depending on the weight loss needs, so you're asking about something for weight loss and inflammation. Depending on the needs, I would likely choose two different peptides, one geared more towards fat burning, so AOD, for instance, and then I would pair it with another one that really targets inflammation well, so your BPC 157, your TB 500. CJC with ipamorelin is also very good because you get a little bit of both benefits from that particular peptide. And then I have one last question on here, and it is, what do you think about stem cell procedures? I love them. So I covered this in the presentation, but I want to recap. They are very safe, they're effective, they're non-invasive, and they can treat a variety of health conditions. So we can use them for health conditions, bone, muscle issues, chronic pain, but we can also use them for health optimization. They're great for healing various tissues, also great for rebuilding the immune system, which helps us to better fight off disease and illness. So yes, I do love stem cell procedures. And then I believe that is the end of our questions for tonight. I want to thank you all again for joining me. My hope is that everybody will leave this presentation with some great education and insight on regenerative medicine. And I hope to see you all in the office really, really soon. Thank you so much. Have a wonderful evening.